And now we have a very nice surprise, if you will. We're delighted to see that we have been joined by Congressman Jim Langevin. And welcome, Congressman. We're glad you're here. Earlier this year, AARP was proud to sponsor a teletown hall with the Congressman. We started with him because he was first out of the box with significant health care legislation some years ago, perceiving the need and working hard on it over a number of years. And I'd like to give him the opportunity to say a few words now if he would like to. Congressman?
Thank you very much. I want to say how pleased I am to go to stop by for a few minutes for this very important event. And I want to commend AARP and the Rhode Island State Nurses Association for hosting this event, to have a real dialogue about what health care reform really means. I want to commend my colleague, Congressman Kennedy, for co-hosting, sponsoring, and being one of the primary speakers here today. Patrick and I obviously work very closely together in the House on behalf of all the people of Rhode Island, but in particular on this issue of health care reform. We are joined at the hip, and we're doing our best to make sure that we get the word out there about what health care reform does and does not do, its importance. And I can assure you that we're working very closely together to make sure that the health care reform bill that's making its way through the Congress is done the right way. And I know that I speak on behalf of Patrick as well, that we will support nothing that hurts our seniors in any way, that doesn't protect our seniors, our retirees, our most vulnerable, and all those that are in need of better health care. And I think we all are. Let me say that Nick said it best, and I'm sure that Patrick and others have mentioned it, that the current system that we find ourselves in is both unaffordable and unsustainable. When you look at in 2000, 2001, the cost of a family plan was around $6,000 or $7,000. Today, it costs anywhere from around $14,000 to $15,000. And if we do nothing, by 2016, the cost of a family health care plan will be about $24,000 or $25,000. It's putting businesses in a period where they're less and less competitive with businesses and workers around the globe. And again, the system is just on a path that is just unsustainable. It's becoming more and more unaffordable for individuals and families, businesses, and government. And again, we are working out, we're about to create, I believe, on the threshold of creating a healthcare system that is going to be much better for everyone, that will be affordable, and that will deliver better health care for everyone. In particular, for our seniors, in particular, one of the major things that we're doing is closing the donut hole significantly right away. And I think that's vitally important. So the fact that we're having this dialogue here this morning is important. Hopefully we can clear up some of the misconceptions, answer questions about the bill. And I think it's just so important that AARP and the Rhode Island State Nurses Association, along with Congressman Kennedy, are hosting this event, having this dialogue. And I know you're going to get some great information here today. But this is what dialogue is all about. This is, again, we're on the threshold of an important change, but one that is going to benefit the country, not only now, but well into the future. So thank you for being here this morning. Thank you for letting me stop by for a few minutes, and I look forward to hearing the discussion as well. Thank you.
Thank you. And now, with all due respect to our panel and to the Congressman, we come to the best part of the program when we hear from you, our audience. If you have cards with questions, I have some here, and I'm going to start with them, and if you have a question that you haven't submitted, raise your hand, and I will try to get to you. We're already limited by time. This card says, I have Blue Cross and Blue Shield with no prescription plan. I have Part D prescription plan, and it's a big chunk out of my Social Security check monthly, close to $100 monthly. What effect would a health care reform bill have on Part D? Who would like to take that one? Congressman?
As I mentioned, Marx obviously this closes the donut hole, but most importantly, overall, as I said, for everybody, and this is really important to distinguish between all the talk about different plans, is that the out-of-pocket expenses of this proposal include premiums, co-pays, deductibles, all of it. If you have to understand your total expenses is what is contained in the coverage of this health care plan. So if you compare that to what is often termed, well, we'll save you, our premiums in the private sector plan are going to be lower, whatever, than any proposed plan the government offers. It's deceiving because there's no guarantee that it'll include lower deductibles and co-pays and the like. What we have in our plan is a global cap on out-of-pocket expenses so that you can be sure that you get the coverage, including prescription drug coverage, without exceeding a percentage of your income and having a cap put on your coverage for your annual or lifetime limits.
Thank you, Congressman. I'm shuffling these to see if I can kind of eliminate duplications on these questions that have been passed in. This one says, I keep hearing that the donut hole in Medicare will gradually close. Is that true? And if it is, what will be done to keep drug prices down? Panel? Congressman?
Well, obviously, this is why having a public plan is so crucial. Because for us to maintain leverage in keeping costs down, the government has to be able to have the purchasing power that it currently has when negotiating drug costs under the VA system. It has a formulary that has costs 40% lower than the average cost. Now, what I would like to see, should we not have the public plan, is all drugs and services offered at the lowest advertised rate for everybody. Transparently. So there's no 5 different costs for the same drug. And I think there you're going to have, there you'll have true market competition, because you're not going to have one plan subsidizing another and people paying more if they get stuck in the wrong situation. But ultimately, I think that we're going to have the government leverage in order to keep costs down. As you recall, the pharmaceutical companies came to the White House and promised, as they did, to reduce their costs as part of their commitment to bringing costs down. They understood the need to do this, because if they didn't, the public pressure on them would be so great that they would lose, I think, in a political battle on the Hill. But that said, it's important for the public to maintain some leverage.